Librela and Solensia, meant to relieve your pet's pain, is linked to serious adverse reactions, and no one can clearly explain why. Thousands of reports, confused vets, devastated owners. So the question is, what's really going on with drugs like Librela and Solensia? And why are so many people demanding answers from Zoetis? These drugs were introduced as breakthrough treatments targeting nerve growth factor to relieve chronic pain in dogs and cats. But something else has been growing concern. What these drugs are: Librela and Solensia are monoclonal antibody therapies. They're not like traditional painkillers. Instead of masking pain, they block signals at the source. That innovation is exactly why they were fast-tracked and widely adopted. But newer types of drugs often come with a key limitation: less long-term real-world data at launch. The adverse event reports. In recent years, a growing number of pet owners have reported adverse events after injections. These reports include deaths, neurological symptoms, mobility issues, and so much more. Now here's where things get complicated. Adverse event reports do not automatically prove causation. They are signals, not conclusions. But when the volume increases, regulators are supposed to take a closer look. Why causal links are hard to prove. Establishing a direct cause between a drug and an outcome is extremely difficult, especially in veterinary medicine. Why? Because many pets receiving these drugs are already elderly or seriously ill. They often have multiple conditions. There's no controlled environment outside clinical trials. So when something goes wrong, it's not always clear. Was it the drug or the underlying disease? Criticism of testing and approval. Some critics argue that clinical trials for newer veterinary drugs involve smaller sample sizes, do not capture rare side effects, do not reflect long-term use. Regulatory bodies like the FDA or the European Medicines Agency, the VMD, evaluate safety based on available evidence at the time. But no system is perfect. That's why post-market surveillance exists, essentially. Real-world data collection after approval. Why drugs aren't banned. So why aren't these drugs pulled from the market? Because regulators weigh proven benefits, known risks, strength of causal evidence. If a drug helps a large number of animals and a direct causal link isn't clearly established, regulators typically update warnings, monitor data, issue guidance, instead of banning it outright. Accountability and trust. This is where frustration builds. Pet owners want transparency, clear answers, accountability when things go wrong. But pharmaceutical companies like Zoetis operate within regulatory frameworks. They rely on clinical trial data, reporting systems, regulatory approval processes, and when communication breaks down or feels incomplete, trust erodes. The real issue isn't just one drug. It's a bigger question. Is the system designed to detect rare risks fast enough? And are pet owners being fully informed? These medications have concerns being raised by some vets, some pet owners, and watchdogs that deserve attention, not dismissal. Because at the end of the day, this isn't about headlines. It's about trust, transparency, and the animals that depend on both. As a pet owner living through the Librela nightmare, I'm not speaking in hypotheticals. There are documented adverse event reports involving Librela and Solensia, including cases where owners describe their pets as stable or managing prior to treatment, and then rapidly declining afterward. These reports exist. They've been filed. So the question isn't whether concerns are real. The question is, what is being done about them? Why does it feel like Zoetis isn't publicly addressing the full scope of owner concerns? Why are regulators like the Veterinary Medicines Directorate, FDA, and European Medicines Agency not clearly communicating what they are seeing in the data? And why do so many pet owners feel like the system for reporting adverse events is inconsistent, incomplete, or difficult to trust? Because when multiple reports describe similar patterns, even without proven causation, that should be a signal for deeper investigation, not silence. Why are they continuing to license these drugs? Adverse event reports don't prove cause on their own, but they are designed to act as early warning signals. Even if one pet dies, that's a red flag not to use a drug. To stop this, sign Shadow's petition. https://che.it/v8tjfyxv7r